Well, this looked at all the long-term safety issues in the clinical trial as well as part of its extension. And the short story is that overall, when you can look at it compared to a lot of drugs, Omaveloxolone is pretty safe. It's pretty tolerable. There are not a lot of things which appear other than the upfront gastrointestinal side effects in 10 to 15% of people, some headache, some changes in hepatic numbers, transaminases that really just go away and are not accompanied by any synthetic abnormalities of liver function. So this is still consistent with the idea that this is a metabolic event more than a toxic event. And I think really the most impressive thing is that we found all these in the original clinical trial, and at this moment, nothing new is popping up. Normally, broaden the group that you give drug to as you extend it, you start finding new things. I think we're probably seeing a few things, but they haven't even met the threshold yet now. So I think overall, the idea that it's basically a pretty well tolerated drug with a very modest number of safety issues for when you consider the things that it's doing, that in fact is a transcription factor activator influencing the turning on of DNA. There, it's a pretty clean drug for all that considered.
So I wanted to focus in specifically on the gastrointestinal sort of things, as well as sort of the elevated transferase levels. So I'm curious, from a clinician treating perspective, obviously we know that this drug is safe and effective, but from a clinician treating perspective, are there anything that we can do to sort of avoid or maybe even temper some of these adverse events? Anything that you've seen in terms of tinkering the treatment, or just anything, from your own experience as you've gone along this couple of years?
Yeah, so speaking mainly about our practice, which we also presented at the ICAR meeting in a poster, where we've treated more than 250 people clinically since it's been released. There are a few people who, in most individuals, the GI side effects of nausea and diarrhea go away over the course of the first month or 2 months. There are some individuals who really don't tolerate it well, and you can't get onto drug. We have had success in most of those individuals by instead of going up to 3 pills, 150 milligrams right away, by slowly inching them toward that over the course of 2 months, 4 months, 6 months, where they keep adjusting to the dose and you can eventually get there. The same thing is true of the elevated transaminases. We have found that in individuals, there are a couple of individuals who were even within the study who were they had to stop the study because they had levels which are too high. We have treated those people clinically after its release, and they do the same thing. But if you start very slowly and go up over the course of 6 months or more, you can work them to a full dose with their transaminases not hitting any sort of trigger value. The other thing we've learned is to some extent the transaminases, they're not associated with abnormalities of albumin or abnormalities of bilirubin. Thus, it's just a transaminase of, increase. It goes away over the course of 1 to 6 months. That's what the study predicted. And in clinical care, the same thing is occurring. So it's not the sort of thing to get too worried about. It's going to go away.